Welcome to your medical unit huddle for August 13th through the 20th. I'm Ricky, your nurse manager. This week for patient experience is about you. You as the caregiver. When you're rushing around and you're feeling like you're short on time and you've got like 100 things on your list to do and you go into your patient's room, they're kind of being demanding, if you will, and then you go into the next patient's room, you're bringing all of that with you. So what I want you to do before you go into your patient's room is take a deep breath. You are one person and you've got 100 things that you need to accomplish, but the last thing that we need is for our patients to feel like we don't have time for them, we don't have a smile on our face, and they feel bad for you when they feel like you're rushing around, so they don't want to ask for anything, and then they have to suffer. They're already in the hospital, right? So just make sure that you're taking time to breathe, to smile, to just, realize again that you are one person. We'll get it done. We are a team. But anyway, that's starting to reflect in our patient experience, that they're feeling that, for lack of better words, I guess, that they're not being respected because we're trying to rush around and do things, whether we realize we're doing it or not. So anyway, just make it about you, that you are going to take your time for your patients and take a deep breath. I don't want anybody burning out here. So also, thank you cards. Okay, I have 5 for the last week, and I know we've had more than 5 patients discharged, okay? You guys are doing a great job getting them all signed and autographed, but it doesn't help if I don't have people to send them to. So if you get an admission or at some point in your shift, if you could just address the envelope, put it in their chart, then when they're discharged and we're breaking down the charts, we can just slip a card in there. So it's proven that our patients like that, and they really feel appreciated. And so I do have a good patient experience voicemail that I am waiting to get the blessing to share that with you. It was very impactful for me, and I really want to share that with you guys. So those thank you cards mean something, believe it or not. Innovation, last week we had the Visi upgrade. Hopefully those are working better for you. I know some people have consolidated them to make full sets. I'm perfectly fine with that. We are missing 3, and we hate to say missing, we do know where they are, but we are without 3 devices, so we're aware of that. This past weekend we also had the Epic upgrade, which I hear went very well. Please make sure though, if you haven't worked yet, that you have completed that U-Learn before you come on shift. It's super important that you do that because there really are a lot of changes in there, and it was created to make sure that you were prepared, okay? There was a little snafu with some pump integration. Please check your email for all the details on that. I think a couple went out from different people in regards to the pump integration. Staff recognition, they started with the Recognizing You program, the preceptor recognition program. If you have a preceptor that you felt was amazing and you want to get them recognized, go into Recognizing You and look for the preceptor recognition program. Also starting August 14th, quick little survey going out to staff who have less than 5 years of service to see how can we retain you, what works for you, what makes you stay. So if you see that email come through, I think it's coming through Waggle, something like that, please take the time to fill that out. I think it's like 5 questions. Also, we have starting with us this week, Kendra. She is a night shift PRN PCT, so welcome Kendra if you see her. I am going to turn it over to your charge nurse for any quality patient safety concerns. As always, I encourage you to subscribe to our MCR Medical Unit YouTube channel. Have a great shift.